Fentanyl, from Wikipedia, the free encyclopedia, located on the internet at en.wikipedia.org/wiki/fentanyl. Fentanyl, also known as fentanyl, spelled F-E-N-T-A-N-I-L. Brand names: Sublimes, Actique, Duragesic, Duragesic, Fentora, Onsilis, Instanil, Abstral, Losander, and others, is a potent synthetic narcotic analgesic with a rapid onset and short duration of action. It is a strong agonist at the micro-opioid receptors. Historically, it has been used to treat breakthrough pain, and is commonly used in pre-procedures as a pain reliever, as well as an anesthetic in combination with a benzodiazepine. Fentanyl is approximately 100 times more potent than morphine, with 100 micrograms of fentanyl approximately equivalent to 10 milligrams of morphine and 75 milligrams of pethidine, meperidine, in analgesic activity. It has a lethal dose of 3.1 milligrams per kilo in rats, and of 0.03 milligrams per kilogram in monkeys. Fentanyl was first synthesized by Dr. Paul Janssen in 1960, following the medical inception of pethidine several years earlier. Janssen developed fentanyl by assaying analogues of the structurally related drug pethidine for opioid activity. The widespread use of fentanyl triggered the production of fentanyl citrate, the salt formed by combining fentanyl and citric acid in a 1:1 stoichiometry, which entered the clinical practice as a general anesthetic under the trade name Sublimes in the 1960s. Following this, many other fentanyl analogues were developed and introduced into the medical practice, including sufentanil, alfentanil, remifentanil, and lofentanil. In the mid-1990s, fentanyl saw its first widespread palliative use with the clinical introduction of the Duragesic patch, followed in the next decade by the introduction of the first quick-acting prescription formations of fentanyl for personal use, the Actique lollipop and Fentora buccal tablets. Through the delivery method of transdermal patches, fentanyl is currently the most widely used synthetic opioid in clinical practice, with several new delivery methods currently in development. As of October 2011, there is currently a fentanyl shortage in the United States. Medical uses. Intravenous fentanyl is extensively used for anesthesia and analgesia, most often in operating rooms and intensive care units. It is also administered in combination with a benzodiazepine such as midazolam to produce procedural sedation for endoscopy, cardiac catheterization, oral surgery, etc., and is often used in the management of chronic pain, including cancer pain. It has been found to be useful to improve the actions of local anesthetic during root canal treatment. According to E. A. El-Sharawi in the Journal of Pain Symptom Management, 33, 203-207 from 2007, the intra-alignmentary injection of 0.4 milliliters of fentanyl at 0.05 milligrams per milliliter was highly effective in reducing pain when used concurrently with local anesthetic for a pulpectomy procedure, where a hot nerve is removed. Fentanyl transdermal patch, sold under the names Duragesic, Duragesic, and Matrofen, is used in chronic pain management. The patches work by releasing fentanyl into body fats, which then slowly release the drug into the bloodstream over a period of 48 to 72 hours, allowing for longer-lasting relief from pain. The patches are available in generic form and are available for lower costs. Fentanyl patches are manufactured in 5 patch sizes: 12 micrograms per hour, 25 micrograms per hour, 50 micrograms per hour, 75 micrograms per hour, and 100 micrograms per hour. Dosage is based on the size of the patch, since the transdermal absorption rate is generally constant at a constant skin temperature. Rate of absorption is dependent on a number of factors. Body temperature, skin type, amount of body fat, and placement of the patch can have major effects. The different delivery systems used by different makers will also affect individual rates of absorption. The typical patch will take effect under normal circumstances, usually within 8 to 12 hours. Thus fentanyl patches are often prescribed with another opiate, such as morphine or oxycodone, to handle breakthrough pain. Fentanyl lozenges, Actique, are solid formulation of fentanyl citrate on a stick in the form of a lollipop that dissolves slowly in the mouth for transmucosal absorption. These lozenges are intended for opioid-tolerant individuals and are effective in treating breakthrough cancer pain. It is also useful for breakthrough pain for those suffering bone injuries, severe back pain, neuropathy, arthritis, and some other examples of chronic non-malignant pain. The unit is a berry-flavoured lozenge on a stick, which is swabbed on the mucosal surfaces inside the mouth, inside of the cheeks, under and on the tongue and gums, to release the fentanyl quickly into the system. It is most effective when the lozenge is consumed in 15 minutes. The drug is less effective if swallowed, as despite good absorbance from the small intestine, there is extensive first-pass metabolism, leading to an oral bioavailability of 33%. Fentanyl lozenges are available in 6 dosages from 200 to 1600 micrograms in 200 microgram increments, excluding 1000 micrograms and 1400 micrograms. These are now available in the United States in generic form, through an FTC consent agreement. However, most patients find it takes 10 to 15 minutes to use all of one lozenge, and those with a dry mouth cannot use this route. In addition, nurses are unable to document how much of a lozenge has been used by a patient, making drug records inaccurate. Over 2008 to 2009, a wide range of fentanyl preparations became available, including buccal tablets or patches, nasal sprays, inhalers, and active transdermal patches, heat or electrical. High-quality evidence for their superiority over existing preparations is currently lacking. Some preparations, such as nasal sprays and inhalers, may result in a rapid response, but the fast onset of high blood levels may compromise safety. In addition, the expense of some of these appliances may greatly reduce their cost-effectiveness. On July 16, 2009, the FDA approved Onsilis, BEMA fentanyl, for breakthrough cancer pain. Onsilis incorporates bioerodible mucoadhesive technology, a small soluble film that contains fentanyl, which is placed on the inside cheek of the mouth. In palliative care, transdermal fentanyl has a definite but limited role for patients already stabilized on other opioids, who have persistent swallowing problems and cannot tolerate other parenteral routes such as subcutaneous administration, patients with moderate to severe renal failure, troublesome adverse effects on morphine, hydromorphone, or oxycodone. Fentanyl is sometimes given intrathecally as part of spinal anesthesia, or epidurally for epidural anesthesia and analgesia. Because of fentanyl's high lipid solubility, its effects are more localized than morphine, and some clinicians prefer to use morphine to get a wider spread of analgesia. Adverse effects. Fentanyl's major side effects, more than 10% of patients, include diarrhea, nausea, constipation, dry mouth, somnolence, confusion, asthenia, weakness and sweating, and less frequently, 3 to 10% of patients, abdominal pain, headache, fatigue, anorexia, and weight loss, dizziness, nervousness, hallucinations, anxiety, depression, flu-like symptoms, dyspepsia, indigestion, dyspnea, shortness of breath, hypoventilation, apnea, and urinary retention. Fentanyl use has also been associated with aphasia. Despite being a more potent analgesic, fentanyl tends to induce less nausea, as well as less histamine-mediated itching in relation to morphine. Like other lipid-soluble drugs, the pharmacodynamics of fentanyl are poorly understood. The manufacturers acknowledge that there is no data on the pharmacodynamics of fentanyl in the elderly, cachectic, or debilitated patients, frequently the types of patients for whom transdermal fentanyl is being used. This may explain the increasing number of reports of respiratory depression events since the late 1970s. In 2006, the US Food and Drug Administration began investigating several respiratory deaths, but doctors in the United Kingdom had to wait until September 2008 before being warned of the risks with fentanyl. The precise reason for sudden respiratory depression is unclear, but there are several hypotheses. Saturation of the body fat compartment in patients with rapid and profound body fat loss, patients with cancer, cardiac or infection-induced cachexia, can lose 80% of their body fat. Early carbon dioxide retention causing cutaneous vasodilatation, releasing more fentanyl, together with acidosis which reduces the protein binding of fentanyl, releasing yet more fentanyl. Reduced sedation, losing a useful early warning sign of opioid toxicity, and resulting in levels closer to respiratory depressant. Fentanyl has a therapeutic index of 270. Post-acute withdrawal effects. According to a range of medical journals, there is also an often underemphasized potential for post-acute withdrawal syndrome, which may last until after the initial short term. Post-acute withdrawal syndrome may induce or mimic psychiatric disorders temporarily, or long-term, such as depression, anxiety disorder, psychosis, and in rare cases, even suicidal ideation. Post-acute withdrawal syndrome will continue for some months, usually 1 to 3 or more, after prolonged cessation of usage, which is also referenced in the medical journals on post-acute withdrawal syndrome, or PAWS. Mechanism of action. Fentanyl provides some of the effects of other opioids through its agonism of the opioid receptors. Its strong potency in relation to that of morphine is largely due to its high lipophilicity. Because of this, it can more easily penetrate the central nervous system. Chemistry. Subsection 1. Synthesis. The synthesis of fentanyl, N-phenyl N-1-phenethyl 4-piperidinal L-propyramide, by Janssen Pharmaceutica was achieved in 4 steps, starting from 4-piperidinone hydrochloride. This sequence commenced with N-alkylation of 4-piperidinone with 2-phenylethyl bromide to give N-phenylethyl 4-piperidinone, or MPP. Reductive amination of MPP using aniline and sodium borohydride afforded 4-anylo N-phenylethyl piperidine, or ANPP. Finally, N-acylation of the tertiary amine with propionic anhydride provided fentanyl. Subsection 2. Analogues. The pharmaceutical industry has developed several analogues of fentanyl. Alfentanil, trade name Alfenta, an ultra-short-acting 5 to 10 minute analgesic. Sufentanil, trade name Sufenta, a potent analgesic, 5 to 10 times more potent than fentanyl, for use in specific surgeries and surgery in heavily opioid-tolerant or opioid-dependent patients. Its binding affinity is high enough to theoretically break through a buprenorphine blockade to offer pain relief from acute trauma in patients who are taking high-dose buprenorphine. Remifentanil, trade name Altiva, currently the shortest-acting opioid, has the benefit of rapid offset even after prolonged infusion. Carfentanil, trade name Wildnil, is an analogue of fentanyl with an analgesic potency 10,000 times that of morphine, and is used in veterinary practice to immobilize certain large animals such as elephants. And glofentanil, which is an analogue of fentanyl with a potency slightly greater than carfentanil. A number of other fentanyl analogues exist which are classified in the USA as Schedule I drugs, meaning they currently have no accepted medical use. Many of these drugs have been sold on the street as China White. These drugs include 3-methylfentanyl, thought to be the active constituent of Colocol-1, which is a chemical weapon, 3-methylthiofentanyl, acetyl-alpha-methylfentanyl, alpha-methylfentanyl, alpha-methylthiofentanyl, beta-hydroxy-3-methylfentanyl, beta-hydroxyfentanyl, parafluorofentanyl, and thiofentanyl. History. Fentanyl was first synthesized by Paul Janssen under the label of his relatively newly formed Janssen Pharmaceutica in 1959. In the 1960s, fentanyl was introduced as an intravenous anesthetic under the trade name Sublimase. In the mid-1990s, Janssen Pharmaceutica developed and introduced into clinical trials the Duragesic patch, which is a formation of an inert alcohol gel infused with select fentanyl doses, which are worn to provide constant administration of the opioid over a period of 48 to 72 hours. After a set of successful clinical trials, Duragesic fentanyl patches were introduced into medical practice. Following the patch, a flavoured lollipop of fentanyl citrate mixed with inert fillers was introduced under the brand name of Actique, becoming the first quick-acting formation of fentanyl for use with chronic breakthrough pain. More recently, fentanyl has been developed into an effervescent tab for buccal absorption, much like the Actique lollipop, followed by a buccal spray device for fast-acting relief and other delivery methods currently in development. A new fentanyl product has been approved by the FDA for breakthrough cancer pain called Onsolis. It uses a new drug delivery technology called BEMA, or fentanyl buccal soluble film, which is placed on the inside of the mouth. There appears to be less abuse potential because the drug cannot be crushed up and snorted like other fentanyl products. Society and culture. Illicit use. Illicit use of the pharmaceutical fentanyls first appeared in the mid-1970s in the medical community and continues to the present. US authorities classify fentanyl as a narcotic. To date, more than 12 different analogues of fentanyl have been produced clandestinely and identified in the US drug traffic. The biological effects of the fentanyls are similar to those of heroin, with the exception that many users report a notably less euphoric high associated with the drug and stronger sedative and analgesic effects. The use of fentanyl has caused death. Because the effects of fentanyl last only for a very short time, regular users may become addicted very quickly. Additionally, fentanyl may be hundreds of times more potent than street heroin, and tends to produce significantly worse respiratory depression, making it somewhat more dangerous than heroin to users. Fentanyl is most commonly used orally, but like heroin can also be smoked, snorted or injected. Fentanyl is sometimes sold as heroin, often leading to overdoses. Many fentanyl overdoses are initially classified as heroin overdoses. Fentanyl is normally sold on the black market in the form of transdermal fentanyl patches such as Duragesic, diverted from legitimate medical supplies. The patches may be cut up and eaten, or the gel from inside the patch smoked. To prevent the removal of the fentanyl base, Janssen Silag, the inventor of the fentanyl patch, designed the Duragesic patch. The Duragesic patches contain their fentanyl throughout the plastic matrix instead of gel incorporated into a reservoir on the patch. Manufacturers such as Mylan and Sandoz have also produced Duragesic-style fentanyl patches that contain the chemical in the silicon matrix, preventing removal of the fentanyl-containing gel present in other products. The plastic matrix makes the patches far less suitable to transbuccal use and far more difficult to use illicitly than its gel-filled counterpart. Another dosage form of fentanyl that has appeared on the streets are the Actique fentanyl lollipops, which are sold under the street name of Percopop. The pharmacy retail price ranges from $10 to $30 per unit based on the strength of the lozenge, with the black market costs anywhere from $15 to $40 per unit depending on the strength. Non-medical use of fentanyl by individuals without opiate tolerance can be very dangerous and has resulted in numerous deaths. Even those with opiate tolerances are at high risk for overdose. Once the fentanyl is in the user's system, it is extremely difficult to stop its course because of the nature of absorption. Illicitly synthesized fentanyl powder has also appeared in the United States market. Because of the extremely high strength of pure fentanyl powder, it is very difficult to dilute appropriately, and often the resulting mixture may be far too strong and consequently very dangerous. Some heroin dealers mix fentanyl powder with heroin to increase potency or compensate for low-quality heroin. In 2006, illegally manufactured non-pharmaceutical fentanyl, often mixed with cocaine or heroin, caused an outbreak of overdose deaths in the United States, heavily concentrated in the cities of Dayton, Ohio, Chicago, Detroit, and Philadelphia. Baltimore, Pittsburgh, St. Louis, Milwaukee, Camden, New Jersey, Little Rock and Dallas were also affected. The mixture of fentanyl and heroin is known as magic or the bomb, among other names on the street. Several large quantities of illicitly produced fentanyl have been seized by US law enforcement agencies. In 2006, June, 945 grams of 83% pure fentanyl powder was seized by Border Patrol agents in California from a vehicle which had entered from Mexico. Mexico is the source of much of the illicit fentanyl for sale in the US. However, in April 2006, there was one domestic fentanyl lab discovered by law enforcement in Azusa, California. The lab was the source of counterfeit 80mg OxyContin tablets containing fentanyl instead of oxycodone, as well as bulk fentanyl and other drugs. The China White form of fentanyl refers to any number of clandestinely produced analogues, especially alpha-methylfentanyl or AMF. The Department of Justice document lists China White as a synonym for a number of fentanyl analogues, including 3-methylfentanyl and alpha-methylfentanyl, which today are classified as Schedule I drugs in the US. Part of the motivation for AMF is that despite the extra difficulty from a synthetic standpoint, the resultant drug is relatively more resistant to metabolic degradation. This results in a drug with increased duration. Military use. A derivative of fentanyl may have been used as the Moscow hostage crisis chemical agent. The Danish army is also using the fentanyl stick in military operations as a painkiller. In the documentary film Armadillo from 2010, a medic mentions the actual use of fentanyl on a severely wounded Danish soldier in Afghanistan. United States Air Force pararescue used the fentanyl lollipops, and Mossad agents used levofentanyl in their 1997 attempt to kill Hamas leader Khalid Mashal. Overdoses, recalls, and legal action. A number of fatal fentanyl overdoses have been directly tied to the drug over the past several years, particularly in manufacturers of time-release fentanyl patches have come under scrutiny for defective products. While fentanyl contained in the patches was safe, a malfunction of the patches caused an excessive amount of fentanyl to leak and become absorbed by patients, resulting in life-threatening side effects and death. Regardless, fentanyl is considered the most safe opioid medication on the US market, as well as the least harmful to the physical body, especially with long-term or life-term use. Manufacturers of fentanyl transdermal pain patches have voluntarily recalled numerous lots of their patches, and the US Food and Drug Administration, the FDA, has issued public health advisories related to the dangers of the fentanyl patch. Manufacturers affected include Janssen Pharmaceutical Products LP, Alza Corporation, Actavis South Atlantic LLC, Sandoz, and Cephalon Incorporated. On September 25, 2002, former WWF and ECW professional wrestler, Pitbull No. 2, Anthony Duranti, was found dead in his home alongside his wife, whom was also found dead. They both died from a fentanyl overdose. Their 2 infant children were found inside the home alive and well. On May 24, 2009, Wilco's former guitarist, Jay Bennett, died in his sleep of an overdose of the drug via Duragesic time-release patches, which he was prescribed. In 2010, Slipknot's bassist Paul Gray died after accidentally overdosing on a mixture of fentanyl and morphine. An inquest jury found by a majority verdict of 3-2 that an overdose of fentanyl was responsible for the death by misadventure of Anita Chan Lai-ling, 69, who died on October 17, 2007, after she was given an overdose of the powerful drug. This sound file and all text in the article are licensed under the Creative Commons Attribution Share-alike 3.0 unported license, available at http://creativecommons.org/licenses/by-sa/3.0. This article was taken from a revision made on the 29th of November 2011 at 10:41 p.m. and was recorded by Torsten Malmisen, Wikipedia user Barkingfish.